Hi, I'm Kamara Casson, and this is Dr. Joel Kailia.
AKA the Pain Geek.
We're both in Nelson, BC, because Joel owns this clinic called Rise BC Wellness Center where he helps treat people with chronic pain. So I was curious, what made you decide to treat people for chronic pain?
That's a good question, Kamara. When I was younger, I had this episode where I had 10 out of 10 pain in my hip. And I went to a local emergency department and I really was brushed off. I felt like they didn't believe my pain and they sent me home without any treatment. And that developed into a chronic pain problem. So since that time, I've been looking for non-medication ways to treat my pain. And I feel like I've come up with a holistic way to treat pain.
So your clinic is different than other clinics because you offer things that help people with pain that aren't drugs?
That's right, we are an interdisciplinary clinic. That means that we have people from all different sorts of fields that are here to help you with your chronic pain, such as a nutritionist, a clinical counselor, a social worker, a kinesiologist, a massage therapist, an acupuncturist, and more.
In all the people that you've seen, is there anything that really stands out for a cause of chronic pain?
In the majority of people that come see me, there is some sort of component of myofascial pain, and that's what we're going to be talking about today.
What is myofascial?
So you can think of the myofascia as being the muscles, ligaments, tendons, and even the coverings of the joints that go throughout our body. This makes a huge organ that is usually bathed in a fluid that's full of electrolytes, which means that it can carry an electric charge. When you're injured or have overuse or other problems, the whole body can change, and that certain areas in your body can be stuck or triggered, as we call it.
So how do you treat this myofascial pain without drugs?
All right, so there are many ways to treat myofascial pain, but one of the simplest and cheapest ways is to use rubber balls like this.
Is that what they call ball rolling?
It is, or myofascial release. And is it okay, Kamara, if we do a quick demonstration of how the myofascial system is interconnected throughout the body?
I'd really like to see that.
Okay, so first we're going to do an exercise where you stand with your feet hip distance apart.
Okay.
And then I want you to bend forward to a comfortable level. If you need to, you can micro bend the knees. And now I want you to pay attention to what you feel in your lower back. Do you feel tightness on the left side or the right side? Just try to pay attention.
Should I let my head hang?
You should let your head hang in a neutral position so that you're not tensing up your neck muscles. So do you have an idea of which side is tighter?
Yes.
Okay, then slowly come on up. And which side did you feel was tighter?
The right.
The right side. Okay, so we're going to demonstrate how the right side of the back is connected to the base of the foot. So I want you to take this ball and find the fleshy part of the foot in what we call the arch. And when you roll the ball around, you're going to feel these really tight, painful knots. I want you to find one of those knots and then to spend some time slowly rolling that knot to the left and the right, and then slowly back and forth. Do you feel a really tight spot down there?
Mm-hmm. I do. I didn't realize that my arches were so tight.
If it's too intense, what you can do is you can have a chair beside you and you can put some of your weight on the chair, because sometimes it can be really tight.
I imagine it could be.
So we're going to do this for about a minute or so. So how did that go?
It's good. It feels good. It's kind of sore. It's very tender, but it's nice that I can control how much weight I put on it so that I'm not making it too hard.
Great.
Yeah.
So now I'm going to take the ball, and we're going to go back to that same position you were in before.
Mm-hmm.
And then I want you to do the same forward bend.
Okay.
And then take notice of how you feel in your lower back. So come on back up. Does it feel any different?
Yeah, I'm noticing that there's actually less tightness on that one side. Actually, I would say both sides even. I wonder what it would be like if I did the other foot as well. Would you recommend doing both feet?
I would. Yeah, so this is a demonstration of how the myofascial system is interconnected. There's a myofascial line or plane from the bottom of the foot, up the back of the leg to the back, and even all the way up to the head and to the scalp. So, rolling the ball on the bottom of the foot can actually help headaches.
That's pretty amazing. I had no idea. I think I'm going to have to get one of those balls. So in this series of videos, Dr. Kailia and I are going to demonstrate ways that you can relieve your myofascial pain in different areas of your body. Which area are those?
Okay, so we're going to be starting with the calf and foot, then going to the quad and hamstring, followed by the glutes and the lower back, then the thoracic spine, which is up here, and then the shoulder, then the neck, the jaw and the head, and finally the arm and the hand. Each week, we're going to be talking about the 4 R's of rehabilitation: roll, release, restore, and relax. We're going to be releasing and rolling with these balls, and then we're going to teach you how to relax using mindfulness and meditation.
That sounds fabulous. If it can help get rid of this headache that I've had for days, I would be very grateful.
I think we can.
Wonderful. Let's get to it.